Hi everyone, so today in the health tip, I'm going to be talking about something called gastroesophageal reflux disorder disease. And it's an interesting topic. One of my patients just today, she had been under care for about a month and a half, and we did her first progress exam. And she said, yeah, you know what, I've just noticed that I've actually taken a lot less antacids since I've started care here. And people say, well, how can chiropractic working back here have anything to do with your stomach or your acid and that kind of stuff? So I'm going to talk about that, the big picture of all this. So here's your mouth up here, and then you have the big tube coming down, which is your esophagus, then which feeds into your stomach, like that. Over here you have your liver, and your pancreas over here, gallbladder. So just think about different environments in the different parts of your body. So when you have good stomach acid, your stomach should actually have a fairly high acid content because the idea of the stomach acid is to help break down proteins that you might be eating. So starches are going to start their digestion in your mouth, so chew as best you can, and just in general it's a good recommendation to chew your food as much as possible because your stomach doesn't have any teeth. So the less you chew up here, the more that's going to cause problems down here. So anyway, so the stomach, you really want it to have a pretty high acid content to it so that it'll actually break down properly the proteins that you're eating. So one of the problems is, here's the esophagus here, and when you eat food, there's a signal to your brain and it knows that food is coming down here, and it actually causes your stomach to produce acid. And when acid goes into your stomach, there's these little receptors on the top part here which will actually cause a sphincter, or like circular muscles at the top part of the stomach at the bottom of the esophagus to close. So the idea is the food goes down, but the acid content in your stomach is causing the esophagus to close, so that way the food remains down here to be digested and the acid stays in your stomach and it's not going back up to cause problems inside your esophagus. Now for the most part, really, the acid of the stomach would actually burn holes in your esophagus, or really that indigestion or heartburn or the reflux, it's really not really the acid coming up. It's a bit of a combination of a number of different things. So basically what's happening is, big picture idea is that the acid content of your stomach is actually going down. So you actually have less acid in your stomach. Decreased acid in your stomach is actually what's going to be causing the symptoms of heartburn and gastroesophageal reflux, which is kind of interesting. It's sort of backwards to what people would think. And the last thing you should be doing if your stomach acid is going down is taking antacids, right? Because antacids are actually going to cause even more decrease in your stomach acid, and you're going to be even digesting your food even more poorly. So why does that sort of happen? Well, if your stomach acid is low, what's going to cause your stomach to have less acid production? Some of the obvious things, or less obvious, taking Tums and Rolaids and all those antacids will actually decrease your stomach acid production, but some of the less obvious ones are actually when you're eating a lot of junk foods and you don't have a good diet, and you're not eating real foods with a good amount of vegetables that will be providing a lot of the B vitamins. There's 3 or 4 B vitamins that they're actually necessary for your stomach to produce a lot of acid. But one of the big things that people wouldn't kind of put 2 and 2 together is actually stress. So in the big picture, if your body's experiencing stress, it perceives stress as a threat to its existence. And so it doesn't put a lot of emphasis on the sort of luxury items of the body, like digestion, your immune system, your reproductive organs. All those things get, we say, down-regulated when you're under stress. And what your body's trying to do is just survive the moment, and it's putting you in the fight or flight sort of scenario of your body. The fight or flight scenario, your blood pressure is going up, your cholesterol is going up, heart rate, all those kind of things. Insulin levels are bad, sugar is staying in the blood, so it'll feed the muscles and it's not getting stored properly. And the big thing is it'll actually decrease stomach acid because you're not thinking, your body's saying, I just need to get out of this environment. I'm not thinking about digesting my food or fighting a disease or something like that. So that's why stress has negative impacts on your immune system, your reproductive system, your digestive system, your hormonal system, etc. So there's a big nerve, if right up here, you have your brain and your gut are very, very well connected. And I've mentioned this a few times, but there's a nerve that comes out of your brain that comes down and it influences all your stomach, your digestive system, pretty much the halfway across your large intestine. It's basically called the vagus nerve. And that nerve works properly when your body is in what we call the relaxation state. So if you're in the fight or flight, this isn't working very well. So what we want to do is do things that will increase your vagal function, because increasing your vagus will actually help increase your stomach acid, because that's your body's more in the relaxed, digest, and reset mode if you're having your vagus nerve working properly. So a couple things that will increase your vagus nerve function is having the first vertebrae in your neck properly aligned, because the vagus nerve actually comes into your body right in front of that first vertebrae. So if the first vertebrae is out of alignment and is pushing forward like that, it can actually stress that nerve, cause problems. That's why a lot of kids after they're born, when they pull on the baby's heads, can have a lot of reflux and spitting and all that kind of stuff, and not digesting their food or the breast milk or whatever. And colic and everything can be related to that as well. But in older people, it can be a big factor in decreasing stomach acid. And the problem is, if you have low stomach acid and you eat your protein meals, the protein is not getting broken down properly, and it will actually start to ferment. The fermented gases are what can actually leak back up through the esophagus and start irritating the lining and causing the pressure and the heartburn. So, and even lower down in your intestine here, the intestine is a little more alkaline, we call it, and sometimes if undigested food is coming into here, it can cause lactic acid buildup, and that lactic acid can actually come back up and push things as well. But very often it's just sort of the gas from the fermented byproducts of not digesting your proteins properly is what's actually pushing through that valve, because it's more of a gas than the actual acids, and that gas can be irritating to the esophagus. So big picture, try to decrease your antacids, taking as much as you can. Try to improve your stress response, so that way you're putting your body more in the parasympathetic. So the technique that I use, the network spinal analysis, we know that it has a big effect on helping your body go into the parasympathetic relaxation response. So that's very important. But there's a research study that was out a little while ago, and this is actually really kind of disturbing a little bit. Often when people have what they think is acid, too much acid, they give them what they call proton pump inhibitors, proton pump inhibitors. That's the drugs that they give people when they have acid reflux. So the unfortunate thing is that they're finding that the proton pump inhibitors actually cause polyps to start to develop in the stomach. And if they're in susceptible people, it can actually start to cause adenocarcinomas in the stomach itself. So people taking antacids, like antacid drugs, proton pump inhibitors, because they hypothetically have high acid, which they really don't, but they're taking that to lower the acid production, and often there's a rebound acid production after this. With most drugs, there's always like a rebound effect, but regardless of all that, they're taking these proton pump inhibitors because they think they have too much acid in their stomach, which they actually don't, but using that over a long period of time can actually cause what they call gastrointestinal hyperemia, I think it's called, and so there's a lot of polyps building up. The stomach lining actually gets really funky, and it starts to build polyps in it, and it can actually become cancerous in the stomach. So we really got to take back control of our health, and we really got to start eating real foods, controlling our body, making sure that our nervous system is controlling all the organs, tissues, and cells in our body properly, and that's the job of the chiropractor. So wherever you are in the world, if you're seeing this, make sure you're getting your spine and your nervous system properly checked on a regular basis, so that the brain and the nervous system can control all these things the way they're supposed to. Okay? So that's the big picture talk for this week. And so if you like the video, please share it. And information for our office is down below if you'd like to check out what kind of work we do in our office. And you can email us or give us a call, and we'd look forward to seeing you.